Um, so, Tony, I think I'll start back in the beginning. So I'm 58, going on 59 years old, and I'm white female. um, let's see. I was diagnosed with diabetes probably when I was around 40. I had a high HbA1c, or a high morning glucose, and then they did an HbA1c, which I think was 7 something in the very beginning. So that began my story, and I used diet and exercise for many, many years to control my blood sugar levels. As I started to I entered into a master's program when I was 48, and noticed through those years, between 48 and 51, that my blood sugar levels were more difficult to control. They seemed to be getting higher. I should step back a little bit. I went to a naturopathic doctor probably within the first year. I went to 2 different naturopathic doctors. And we noticed when I was doing my blood sugar levels that I would have a spike after I became upset, or in my life with any person or any interaction, that I would have quite a significant increase in blood sugar level without eating. I also experienced firsthand the dawn phenomenon, which is, I'm sure you guys know, but elevated blood sugar in the morning. So fast forward, I'm in a master's program when I'm 48 to 51, and I notice as I go through this master's program that it becomes increasingly more difficult for me to have normal or near normal blood sugar levels. So I began exercising more and eating less to try to control my blood sugar levels. I graduated from the master's program, took my first job in the healthcare profession, and 6 weeks later, I had a heart attack. So it was quite serious, apparently, and I was hospitalized. In retrospect, I believe I had 3 heart attacks, 2 on 1 week, and then everything laid quiet. And then the following week, I had a 3rd heart attack, and I ended up going to the hospital. I didn't understand what was happening or why I was experiencing the symptoms that I was doing. But so I was in the hospital, had a stint in my left anterior descending, I think it is, and was discharged 3 days later, but my heart did go into cardiogenic shock. It was quite an experience. So I was placed on 4 different medications from that point. I did go back to work 2 weeks later. As my cardiologist said to me, I healed like no other patient he had ever had. So it seemed as though I was relatively unscathed, but I still had diabetes, and now I have a history of myocardial infarction, non-fatal, but still part of my medical history. That was when I was 52. I was 52 years old, so that was 6 years ago. The 4 medications they put me on was an aspirin, 81 milligrams, a statin, and I believe I was taking 40 milligrams. I was put on long-acting and short-acting insulin. In the beginning, I was put on long-acting first, and then they introduced the short-acting several months later. so that I could have tight glucose control. I'm not sure, cardavilol and also lisinopril. Those were the medications that I was placed on. So I did that for 6 years. It seemed as though blood sugar levels continued to be difficult to control while I was on insulin. Personally, from my perspective as a patient, I was felt that I had to adhere to a medical regimen that didn't align with who I was, and I really wanted a different way, but didn't really want to question after I had a heart attack. So, fairly healthy woman, probably about a year ago, I stopped taking the aspirin. I just didn't want to take the aspirin anymore, and it seemed like the most benign of the medications that I was taking, or maybe the simplest to stop. I think early April, first week of April, I stopped the statin, simvastatin. I was taking 40 milligrams, and I stopped that because I was uncomfortable with some of the studies that were coming out about the link with memory loss, early Alzheimer's, with statin, the use of statin. So I stopped the statin on April 24th. I was reading a book by Jason Fung, I think that's his name, and he wrote the Diabetes Code, and I decided to go ahead and try intermittent fasting, 1 meal a day, and the ketogenic diet for that 1 meal a day. So on April 24th, I stopped Humalog and never resumed Humalog. My reasoning was it was prescribed for with meals, and I wasn't really eating meals. I was eating 1 meal a day. When I ate that 1 meal a day, it had very low carb, so I didn't use the short-acting insulin after April 24th of this year. On April 30th in the evening, I was still taking the long-acting insulin. I had reduced my level from 35 units to 15 units prior to April 24th, and I stopped my long-acting insulin because I had a blood sugar level of 70, and I didn't want to lower my blood sugar any more than that while I was sleeping. So I stopped long-acting insulin on 4/30 on April 30th of this year. Where would I go from there? Okay, I did this for approximately from April 24th until July 3rd. I went to my family physician. I was taking my blood pressure every day to try to monitor that because I was aware that the medications that I was on might alter my blood pressure, and I didn't want to go too low. And then I started to go too low, and I experienced just some dizziness, and checked my blood sugar right away, and it was normal. So I went and checked my blood pressure, and my systolic was under 100. It was 94, and my diastolic was under 50, right about 48 8, I believe. So I cut my lisinopril in half, I believe, and I'm not sure what level I was at, what I was taking originally. I think I'm at 5 milligrams of lisinopril now. I think it was at 10 milligrams. Let's see. So monitoring blood pressure, monitoring blood sugar, and moving along. When I went to my family physician didn't take it very well when I went in and explained to him that I was dialing back medications, and that I was intermittent fasting 1 meal a day. He was not very happy with me, but stated that he was tolerant. I guess we would watch and see. So I went and I looked for a naturopathic doctor and met Dr. Beer. His last name is spelled Bier. He's located in Portsmouth, New Hampshire, and he listened and spent about 3 hours with me when I met him, and suggested that I eat for my blood type. My blood type is type O, and that he was seemed perfectly okay with my stopping the statin. He thought that was a good thing, and provided me with a booklet that covered my treatment plan, supplements, and also recommended diet changes. His recommendation was that I eat every hour and a half to 2 hours, with a huge focus on getting protein into me. And then, other restrictions. So still very low carb. And he presented me with a booklet at the end of my visit, that would allow me to kind of go through it, and in which case I read it twice through, and then began to implement things. He also requested, I guess I didn't mention about the thyroid. I was placed on a thyroid medication. The levothyroxine is 50 micrograms is what it was recommended 6 years ago. Apparently I was low normal range, and they thought that possibly that might help with blood sugar control. It didn't really seem to affect or help or hinder. So I was taking levothyroxine, but I was kind of unclear why I was taking that. So we did a comprehensive thyroid panel, and a couple of things came out of that. I can kind of read to you what was. So for the thyroid, Dr. Beer wrote, it's a good thing we checked almost the full parameters. They didn't check both antibodies, but the one they did check was very high, which indicates an autoimmune thyroiditis or Hashimoto's, which is the cause of your weak thyroid. Another important piece is that your T4 is mid-range normal. However, your T3, the more active hormone, is low normal. That indicates that you are not converting the T4 from the levothyroxine effectively. It's not an uncommon issue for us to see. I would recommend considering changing to the natural desiccated thyroid, which has both the T4 and the T3 in it. And so I now am taking, what's it called? Um, NP thyroid, 30 milligrams, one time daily. Also, Dr. Beer recommended supplements to support different aspects of my health and identified problems. I have a protein shake with whey protein and a solu fiber blend. There's another supplement which is called multi-biophenotype F and digestive biophenotype F. I'm also taking a Proflora and a Pancreum, which I'm assuming supports my pancreas, and an adrenal complex also to support my adrenal glands. And something that I can't pronounce. It's GAVA Quill-H. In addition to that, he put me on vitamin D3, high potency, 5,000 IU one time daily to try to bring my vitamin D level into a better range. We did check my vitamin D level, and he said, geez, what did he write about vitamin D? Well, I don't see that right now, but the vitamin D, he wanted to be more optimally a little higher than where I was measured, but I'm not seeing that right now. Okay. One other thought that I have is that I did stop the statin early April, and within a week or two, I noticed that okay, how do I say this? So 4 years ago, I went through a personal situation that created a lot of stress for me, and I cried about it, and I did cry for quite a while, probably almost 4 years, and I stopped the simvastatin, and within a couple of weeks, I noticed that I had stopped crying, and that was significant. It was huge for me. I just felt different and more calm, more peaceful. So I looked up if there might be a link between statin, the drug statin, and depression, and I was able to read articles that linked statin with depression by lowering your cholesterol level too low, and apparently your brain needs the cholesterol for the neurotransmission of serotonin in your brain. So it was marked for me, and I know where I thought that maybe my crying was situational. I now realize that it could have been exacerbated by using and taking simvastatin on a daily basis and not realizing that there might be a connection between depression or crying. And so that's one more thought is that I am monitoring my blood sugar levels very closely. And I notice eating every hour and a half to 2 hours, my range has gone up a little bit. in 120s is about average 110 to 120, but fairly decent in the morning between 100 and 120, or usually between 100 and 110. I've had some levels that are below 100 since meeting Dr. Beer on July 3rd. But we did notice I began running because we wanted to incorporate vigorous exercise into this regimen. And so I started running on the 12th of July. It's almost 6 weeks. On Thursday will be 6 weeks that I'm running each morning between 6 and 7 a.m. I started running 1.6 miles, and I'm now up to 2 miles each morning. So that starts my day, and I feel great. But one thing I noticed was I would wake up and I would have, say, a first morning blood sugar level of 110 or 104, and after my run, when I would check it to see, I thought to check it to see if it went down from my run, and it did not. It went up significantly, like 163. So I've been kind of watching that, and Dr. Beer said that that was interesting, but it points to an adrenaline rise, which because I hadn't eaten anything. So I think that's it. I just wanted to share that with you, and hopefully it will help someone else and help me too.
Thank you so much, Amy, for sharing your story. So for you docs out there, we will be doing a case report around Amy's experience and submitting that to the British Medical Journal of Case Reports. We've just had one, as a matter of fact, published. Should be coming out this week. And it was on the topic of low carb diets. So what I'm going to do is I'm going to line up some questions because we're about 2 minutes before the end of the program. So we're going to actually handle the questions regarding Amy's case on next week. We'll just have a part 2. What I'd like you guys to do is to think about something. Remember last week we spoke about how it is that you can have a mid-range normal TSH, a high T4, and a low T3. Okay, that was something that Amy just spoke about. I was really happy to hear that her doctor uses words like mid-range normal as opposed to waiting for something to move across some arbitrary line of normal or abnormal. We'll also talk about the situation when your lab presents with a low T4 and a normal T3, right? We mentioned a little bit of that last week. We'll also touch on some of the side effects of non-diabetic drugs that one might be taking, for instance, a statin, HMG-CoA reductase inhibitor, how those can have side effects on your patient's lab panels, and which lab panels you can choose to draw, which will give you a higher sensitivity and a higher specificity to be able to recognize that this is actually an artifact of a drug and not something that your patient's suffering from. And then lastly, if I could ask you very quickly, Amy, we got about 1 minute left. Would you mind speaking to your experience on the intermittent dieting?
Oh, sure. Okay. I began the intermittent fasting on April 24th, and I did it until July 3rd when I met Dr. Beer. My experience was that a couple of things. My experience was that I took to it fairly easily. I was comfortable not eating because I felt safer. And I ended up doing things like drinking Dunkin' Donut coffee with cream in it, and I'm not sure what you wanted me to share. Should I talk about how I stopped pooping as often? And I just kind of reasoned that that was because I was eating less. So that actually happened to me. And I didn't feel that that was healthy, so I was kind of watching that. And I realized pretty quickly that I'm not very attached to food, but I am attached to, I definitely wanted some kind of sweetener. So I've come to a place where I'm using stevia, but a more pure blend, not like a pure stevia extract, as opposed to some of the blends that are out on the market. So it was a fairly simple thing, and my blood sugar levels dropped immediately from the fasting. In fact, when I started eating on July 3rd, my blood sugar levels went up, and I got kind of nervous and went up, as in I was getting 140s and 150s, but we thought that we should ride it out and just kind of keep going with it and keep watching what would happen, and they have dropped down. So I'm not sure. Did I mention something to you before that I'm forgetting, or?
Oh no, I just
No? Okay.
not at
So
all.
my experience was that it was effective and it was a good start, but I felt that it was a beginning and that this is a journey, and I want to be smart about this. And I sought out another physician because I needed someone who would be a strong healthcare provider for me, given my history, and someone who would not be afraid to not adhere to the standard of care. That's what I was looking for, someone who was comfortable with what I was doing and what my path is. So,
Well, thank you so much, Amy. I appreciate it today.
okay, thank you. Take care.
Thank you. Take
Bye.
care.
Thank you.
Bye.
Thank you, everyone. Bye.
Okay, guys. So there you have it. You did it again. Wasted a perfectly good half hour with me. So I see that a lot of questions were generated. I will answer them next week. These lab-related questions. If you have any more, just shoot an email to info@virtualclinic.md, and I will just try to have them queued up for next week's program. Okay, so diabetes again next week, but we're gonna talk about the things that we heard today. Have a great week out there, guys, and I'll see you then. Bye bye.